The importance of mental health support for caregivers cannot be overstated, as caregivers play a vital role in providing care and support to individuals with physical or mental health challenges, disabilities, chronic illnesses, or aging-related needs. The responsibilities and demands placed on caregivers can be overwhelming, leading to stress, anxiety, depression, burnout, and other mental health issues. Therefore, it is essential to recognize and address the mental health needs of caregivers through various support systems, resources, and interventions. Understanding caregiver challenges. Caregivers often experience a range of challenges, including emotional strain, physical exhaustion, financial pressures, social isolation, role conflicts, and lack of self-care time. The demanding nature of caregiving responsibilities, such as providing round-the-clock assistance, managing medications, coordinating medical appointments, and handling complex care tasks can contribute to caregiver stress and burnout. Caregivers may also face grief and loss associated with witnessing the decline of their loved one's health, changes in roles and relationships, and the impact of caregiving on their own personal and professional lives. Impact on mental health. Caregivers are at increased risk of developing mental health issues such as anxiety disorders, depression, compassion fatigue, post-traumatic stress disorder, PTSD, and substance abuse due to chronic stress and emotional burden. Neglecting their own needs and well-being while prioritizing the care of others can lead to feelings of guilt, resentment, frustration, and helplessness among caregivers. The long-term consequences of unaddressed mental health challenges can impair caregivers' ability to provide effective care, maintain healthy relationships, and sustain their own quality of life. Importance of mental health support. Recognizing the importance of mental health support for caregivers is essential for promoting their overall well-being, resilience, and ability to sustain caregiving responsibilities effectively. Providing mental health support can help caregivers cope with stress, manage emotions, build coping skills, enhance self-care practices, and develop healthy boundaries in caregiving relationships. Addressing caregivers' mental health needs can improve the quality of care they provide, reduce caregiver burden, prevent burnout, and enhance the overall caregiving experience for both the caregiver and care recipient. Key strategies for mental health support: education and awareness. Increase awareness about the importance of mental health among caregivers, healthcare professionals, employers, policymakers, and the community at large. Access to resources. Provide caregivers with access to mental health resources, support groups, counseling services, helplines, online forums, and educational materials tailored to their needs. Training and skills development. Offer training programs, workshops, and peer support networks that focus on stress management techniques, communication skills, self-care strategies, and problem-solving abilities for caregivers. Respite care services. Facilitate respite care services, temporary relief, and caregiver breaks to allow caregivers to recharge, rest, engage in leisure activities, and attend to their own needs. Collaboration and coordination. Foster collaboration between healthcare providers, social services, community organizations, and employers to create integrated support systems and referral pathways for caregivers. Flexible work policies. Advocate for flexible work arrangements, paid leave policies, caregiver benefits, and workplace accommodations to support caregivers' work-life balance and mental well-being. Technology and innovation. Explore technological solutions such as telehealth services, mobile apps, remote monitoring devices, and virtual support platforms to enhance access to mental health support for caregivers. Cultural sensitivity. Ensure that mental health support services are culturally sensitive, inclusive, and tailored to diverse caregiver populations, considering language barriers, cultural beliefs, and social determinants of health. Policy advocacy. Advocate for policy changes, funding initiatives, and healthcare reforms that prioritize mental health support for caregivers, improve access to affordable care services, and promote caregiver rights and dignity. Self-care and coping strategies. Encourage caregivers to prioritize self-care activities such as regular exercise, healthy eating, sufficient sleep, relaxation techniques, hobbies, and social connections to maintain their physical and mental well-being. Teach caregivers effective coping strategies such as mindfulness, journaling, deep breathing exercises, positive affirmations, time management skills, and setting realistic expectations to manage stress and build resilience. Empower caregivers to seek help when needed. Communicate their needs assertively, set boundaries, delegate tasks, ask for support from family and friends, and practice self-compassion without feeling guilty or ashamed. Evaluation and continuous improvement. Regularly assess the effectiveness of mental health support initiatives, caregiver programs, and interventions through feedback mechanisms, surveys, outcome evaluations, and qualitative assessments. Incorporate caregiver input, lived experiences, and preferences into the design, implementation, and evaluation of mental health support services to ensure relevance, accessibility, and impact. Collaborate with stakeholders, researchers, and experts in the field of caregiving and mental health to share best practices, innovative approaches, and evidence-based strategies for supporting caregivers effectively. In conclusion, the importance of mental health support for caregivers cannot be emphasized enough, as caregivers play a vital role in supporting individuals with diverse care needs. By recognizing the challenges faced by caregivers, addressing their mental health needs, and implementing comprehensive support strategies, we can enhance caregivers' well-being, resilience, and ability to provide compassionate and effective care. Together, let's prioritize mental health support for caregivers and create a more caring and supportive society for all. Don't forget to like, share, and subscribe for more valuable information on health.